Hello.
Yes,
Good morning, everybody.
Good morning, madam.
Can you hear me?
Yes, madam.
Okay. Then let's start this revision. Thorax. Actually, in this session, I want you to explain with the marking scheme and how to answer this essay question. Take 30 minutes. Assume that you are in an exam. Please don't look at the books and let's answer to this question. Then after 30 minutes, I will discuss this question with your answer and with the model answer. Okay?
Okay, madam.
Hello?
Okay, madam.
Write down this question. Read this carefully and take 5 minutes to understand the question and then think about your answer make a sketch, rough answer and then write it in proper way. Okay, start now. State the enlarged chamber of the heart. Hello? Let's stop work. Can you hear me?
Yes, madam, we can hear you.
Okay, good. Nice to hear you. Be relaxed now. This is not your exam. Let's discuss this. Okay. Who wants to read your answer? I think there are only few students with me. What is your answer to question number 1?
Left atrium, madam.
Just don't write anything. Just write left atrium. Then you will get 10 marks. Don't write any unnecessary things. Okay. Then, who is this? The milk. The mail, can you read your answer to the question number 1.2? Hello? Hello? Can you hear me again?
Yes, madam, we can hear you.
Okay, then question number 2. Anybody who wants to read your answer, please read.
May I, madam?
Yes, of course. Sure.
So the upper 1/3 of the esophagus is supplied by the inferior thyroid artery, while the middle one.
Not question number 1.2. Second one.
Okay. Yeah, I have written the same answers. The bronchus, left bronchus, the diaphragm, and the arch of aorta is what I have written about. Ma'am, pharynx. Would the pharynx constrict as well, madam?
Pharynx.
Yeah.
Usually these 3. Not pharynx. Yes.
Okay.
Arch of aorta, left bronchus, and diaphragm. Then if you write these in, just what is your question then? List 3 anatomical structures. List mean 1, 2, 3. Then please don't write anything. You do not need to describe, just list 1, 2, 3. Then what is mark? You will get 15 marks if you write these 3 words.
Okay, ma'am.
15 and here 10, 25. Then out of 100, by now you have scored
25.
25. Good. Then what is the next one? First read your question.
Describe the blood supply of the esophagus with its clinical significance.
Clinical relevance. Okay, when you read this question, what is describe?
Describing, you have to explain.
You have to explain and elaborate your answer. Describe the blood supply of the esophagus. Then you imagine and assume what are the things that you know about the blood supply of esophagus. Then we know that it has 3 parts. Cervical part of upper 1/3, middle 1/3 and lower 1/3. Then blood supply means you have to write both
Arterial supply, venous drainage.
arterial supply and
Venous drainage.
venous drainage. Can you read your answer then?
Okay,
Everybody please listen.
The upper 1/3 of the esophagus is supplied by the inferior thyroid artery, while the middle 1/3 is supplied by the esophageal branches of the descending aorta, and finally the lower 1/3 which is supplied by the left gastric arteries. The venous drainage of the upper 1/3 is to the inferior thyroid veins, while the middle 1/3 drains into the azygous veins, and finally the lower 1/3 drains into the left gastric veins, which are tributaries of the portal vein. The clinical importance, the lower 1/3 of the esophagus takes part in a portal system anastomosis, where tributaries of the left gastric vein to the esophagus anastomose with the azygous vein to the tributaries to the esophagus. This is important because during portal hypertension, these veins in the esophagus can dilate and be varicose, and varicosities of the veins could cause rupture and lead to vomiting of blood or hematemesis. Yeah,
Okay. Then bypass system. Esophagus venous system is there. Can this way of bypass? Anybody else who wants to read your answer? Hello. Be relaxed. This is very friendly communication. I just want to help you to improve your answers. Okay. Can you tell me your name, please? This girl?
Musnifa, madam.
Sorry?
Musnifa.
Okay. Good. When describe, you just mention arterial supply. You just mention upper 1/3.
Yeah, lower 1/3 and middle 1/3.
Middle 1/3 and lower 1/3. Describe. If you, for your answer, I can just give you 20 marks out of 30. Why?
I didn't describe, I listed.
Yes, you haven't described adequately. This description is very important. Inferior thyroid artery, because you are inferior thyroid artery, from where it arises?
Inferior thyroid. Inferior thyroid artery. Give me a minute, madam. Inferior thyroid artery from the external carotid artery. Madam?
Yes, yes.
From the external carotid, madam.
Can you check it? I think you have a book. Just check it and tell me.
Inferior thyroid artery, thyrocervical trunk. It's the superior that comes from the external carotid.
External carotid artery. Yes. Then if you write that, then I know that you have this knowledge. It's a branch of thyrocervical trunk, which is a branch of, from where it arises?
Subclavian artery.
Which part of the subclavian artery?
The second.
That means you have to read some more. No problem. You can get 20 out of 30 means it's a lot. But if you want to reach that high level, somewhat
Yeah,
high
ma'am.
level, distinction, then you have to write some more.
Yes, ma'am.
Okay?
Yes, ma'am.
Then second one.
Esophageal branch of descending aorta.
One branch or
Branches, madam. There's quite a few.
okay. Then I'm telling you this mark allocation. Then what is third one?
The left gastric artery from the celiac artery.
Yes. Then describe. Then just try this distal 1/3, the last part of the esophagus is in the
Portal.
no, it is located where?
In the abdomen.
In the abdomen. It pierces the diaphragm and it's in the
Abdomen.
abdomen. Then blood supply is from the
Left gastric artery from the celiac artery.
yes. Then from where it arises? Left gastric artery is a branch of
Celiac artery.
celiac artery. Celiac artery or celiac trunk.
Celiac artery.
Okay, then if you write in that way, then you will get some more marks.
Okay.
Okay. Then venous drainage.
I wrote the upper 1/3 drains into the inferior thyroid veins. So I have to write where it will drain again.
Yes. And then second part?
To the azygous veins.
Again, like this is list like or state like, not describe. No, your description is not adequate. Okay? Yeah. Then what is this part? Clinical relevance. You have mentioned that adequately, but still you have to mention that this is a branch of this systemic and portal anastomosis type and the branches involved in this portosystemic anastomosis.
Yeah, I have mentioned, madam, that tributaries of the left gastric vein to the esophagus part of the portal system, and the azygous vein tributaries to the esophagus are the systemic venous systemic veins that take part in the anastomosis. Would that be adequate, or should I explain more?
Okay, then drain this azygous vein drain into where?
Azygous vein, inferior venous cava. I'm sorry,
Just me, it's okay, be relaxed and no problem because you have enough time to study. Read that and then read, then this is an example. Okay, because I know that you are doing some hard work, right? Then you can improve.
Yes.
Yes. Okay. Let's look at. Then this is blood supply. Describe 3 sources of arterial supply. You will get 5 into 3, altogether 15. But if you just mention, then you will get 5 into 2 and then 10. Okay, venous drainage. Again, same. If described, you will get 5. Okay, before that. What is next? Describe the blood supply. Describe the light microscopic appearance of middle 1/3 of esophagus. What are important things here? Light microscopic appearance, not the histology. So basically you can describe what you have seen during your practicals and also from your recommended textbook. Light microscopic appearance in low power and high power. What is the other important thing? Middle 1/3. Not the upper 1/3 and not the lower 1/3, middle 1/3. Then what are the things unique or peculiar this middle 1/3 of the esophagus? Again, who wants to read your answer? I think nobody. Hello?
We can hear you, ma'am.
Yeah. Somebody else? Disanayaka? Hansika? Hansika Piumali? Okay. Okay. Can you read again? Describe the light microscopic appearance of middle 1/3 of the esophagus. Then what are the important things that should be there?
I think you need to mention about the fact that I think the most prominent one that I have found, madam, was the fact that there are smooth muscles and skeletal muscles in the muscularis propria.
Yes, some more towards the smooth muscle, both in skeletal and smooth
Yeah.
muscles. Yes.
I think that's what differentiates
Yes.
the layers. So that's very important to write. And the fact that the innermost epithelial layer is like shriveled, kind of.
Okay. Then actually, if you, what is this? Describe the light microscopic
Appearance.
appearance. Then if diagram, what do you think about?
I have drawn the diagram, madam.
Yes, if you have drawn the diagram, then mark allocation, the label diagram without any description. If no description, then no marks for that, because if this diagram is there, it's a label clear diagram, you will get 10 or 12 marks maximum. There is no description, then you have to describe this.
Yes.
Arrangement, ordered manner, lumen, then mucosa, then 3 layers of mucosa. Describe the 3 layers of mucosa. Epithelium,
Submucosa.
lamina propria, and muscularis mucosa. If you look at this diagram, you can see lumen here,
Yes.
then epithelium. Then epithelium, if you mention the epithelium, what is the lining epithelium? If you mention that pseudostratified, what is not pseudostratified? Stratified squamous, non-keratinized epithelium. If you have named it, then you will get additional 2 marks for that. Just epithelium, then no marks. Epithelium, then lamina propria, and what is muscularis mucosa. These are the 3 components of mucosa. Then submucosa. What should be there in your description in submucosa? The loosely arranged connective tissues, loose connective tissues are there, lymphatics, blood vessels, nerve endings are there in the submucosa. Then muscularis propria. Then you have to mention this inner circular and outer longitudinal. Yes. In addition to that, this combination of smooth and skeletal muscles, you will get additional mark. Then outer 0. Yes, adventitia. Then this is the description. If name the epithelium and describe the changes of epithelium. If you have to describe this also. In upper 1/3, lower 1/3, and middle 1/3. Lower 1/3
Only smooth muscles.
stay towards the column. Then, yes, these are the things. Then what is the other? Okay. Then another question here. Just discuss. Let's discuss this. First, take 5 minutes to understand, and just take 5 or not 10 minutes. What are the things that should be there in your answer? Read this question carefully. Okay. Then anatomical basis for dyspnea. What do you mean by dyspnea?
Madam, shortness of breathing.
Shortness of breath, difficulty in breathing, and blood stain sputum. When this is then when you are describing the second part, describe the gross anatomical relations of the trachea within the superior mediastinum. Then trachea, it has cervical part and thoracic part. Then here you have to describe the thoracic part only. Relations. What is the level of bifurcation, tracheal bifurcation? Then superior mediastinum. What are the boundaries? Tracheal bifurcation occurs. What is the spinal level, vertebral level?
Madam, is it the fourth thoracic vertebra?
Hello?
Madam, is it between the fourth and the fifth thoracic vertebra?
Yes, fourth and fifth thoracic vertebra. Then you have to write that. From where to where it extends? Superior mediastinum. Anatomy. This is anatomy. Just describe anatomy. Then just you can give brief introduction. Trachea extends from what is the cervical level? Larynx and then trachea. Trachea begins what are the cartilages of the thyroid and then cricoid cartilage at C6 level, 6 cervical spinal level. From it extend that level to the C4, C5. T4 and T5, no? Thoracic. Yes. Then this thoracic part of this part extend from where? Jugular notch? What is that level? Vertebral level. Okay, anyway, this is in the superior mediastinum. It extends up to the level of C4 and C5. Then trachea is the bifurcation occurs at this level, then you have to write all these structures. What are the structures posterior to that? What are the structures anterior to that? Laterally, left lateral and right lateral. Then posteriorly, what are the structures? Take some time and answer to this question. What are the main structures? Esophagus is there. Then what are the structures? What is the structure or structures in tracheo? Esophageal groove?
Recurrent laryngeal nerve.
Recurrent laryngeal nerve. Which recurrent laryngeal nerve?
Left one.
If you want to get more marks, recurrent laryngeal nerve is there, yes.
Left recurrent laryngeal nerve.
Left recurrent laryngeal nerve. Then where is the right recurrent laryngeal nerve? Does it in the tracheoesophageal groove? Yes. Right one. Where? It is in the thoracic part. What else? Sympathetic tract? Esophagus where? Thoracic duct? What else? Read this part. This area is very important.
Okay.
Then anteriorly, what are the structures?
The arch of the aorta and the thorax.
Yes, arch of the aorta. Yes, very good. Arch of the aorta. What else? What are the veins? No, arch of the aorta. And what else? SVC? What is the vein? Vagus nerve. Phrenic nerve. Think about what are the nerves? What are the arteries? What are the veins? Relations. And other soft structures. Viscera, esophagus. Now you can disorganize your answer and write it as your homework. Then describe the lymphatic drainage of the lungs. Lungs. Marks 25. How do you organize your answer? When you are writing this type of answer, this is first you read the relevant areas from your recommended textbooks. Cunningham, Snell, Harold Ellis, and then right, first you can write all these things, even just copy, just look at the book and write down. Then close books and write it again. Using your own words. Practice it, read it again, write it again. No problem. You have enough time. First, be relaxed, be positive, and just look at all these diagrams, label diagrams. Then you can write this, just write. Use your simple words, simple terms, and anatomical terms. We need that, but just use simple sentences and write. Again, embryological development of lungs. No, before that. Describe the light microscopic appearance of trachea. Light microscopic. Can you remember this diagram? Light microscopic appearance. During your practicals, not exactly this, but there is a cross section of trachea with this damaged slide. Then you can think, this is the appearance of slide, it's broken slide. I saw that during our practicals, and I can apply that knowledge. Cross section of this trachea. You can identify all these layers. If you look at this in high power, these are the things that should be there in your answer. Again, mucosa, submucosa. Mucosa is epithelium, lamina propria, submucosa, then hyaline cartilage. If you just write the appearance of hyaline cartilage, and then periosteum, not periosteum, perichondrium, surrounding perichondria, and then adventitia. It's very simple. This is in low power. Then high power, if you want to describe this epithelium, this is very important to write this. Appearance of this pseudostratified ciliated columnar epithelium, if you describe it. All the features. Because this is light microscopic appearance of, describe the light microscopic appearance of the trachea. Then what are the other things? Here you can't see that. But in submucosa, tama natin. Mixed seromucinous glands. Look at your recommended textbook, this histology book, and see. And then start to write. Okay. This is the appearance of this again in high power, in light microscopic appearance, all the features of this epithelium. Then if you write this, you will get more marks allocation for description of this epithelium. Goblet cells. What are the other cells? Basal cells, stem cells, basal stem cells, ciliated columnar cells. The location of nuclei. All these nuclei are confined to this lower 2/3 of the epithelium. You can see this cilia. And this flask shape, goblet shape cells, goblet cells. You can see the location of the nuclei at the bottom. And there are no cilia on the top of these goblet cells. You can see cilia in columnar cells. And what is this? This is the basement membrane, basal cells, basal stem cells. Okay, this is lamina propria. And then again this. What is this? Can you identify this? You can see this submucosa with mixed seromucinous glands. You can identify these mucus glands and serous glands. Serous glands are, these are serous, yes, dark stain, and these mucus glands, pale stain glands. You can see the location of these mixed seromucinous glands in the submucosa. You can identify this epithelium and the lamina propria. Then this hyaline cartilage. The perichondrium here and perichondrium, and then outermost adventitia. This is the light microscopic appearance of tracheal wall. Let's move. Development of the respiratory system. Then what are the basic things that should be there in your answer when you are describing any developmental, embryological development of any organ?
The germ layer it comes from?
Yes. What is the layer? If you look at this, when you are describing this development of respiratory system, it is formation of respiratory diverticulum, lung buds. If you can remember the development of foregut, midgut and hindgut, then it is arising from the ventral wall of the foregut. Appears at 4th week. This is important. You will get marks for this 4th week. and ventral wall of foregut. Then the epithelium is endodermal origin. Endodermal origin. But what are the other structures in the respiratory system? There are cartilages and the muscles of the trachea. Smooth muscles, trachealis muscle, and smooth muscles are there. Then they are derived from it. They have mesodermal origin. Then you have to mention, if you mention this each step, you will get, what is the mark allocation? 20 or 25 marks. You will get 5 marks for these sections. 5 or 4. Then what is this? Septum. This is very important, this septum. Development of this esophageal-tracheal septum. To separate the esophagus from the trachea. Yes, the septum is very important. Then inadequate development or inadequate closure of this esophageal-tracheal septum. This is the clinical relevance of developmental abnormalities. It should be there in your answer because it is very important. We can develop case scenario using this. Just after birth, after feeding, baby gets, or newborn gets dyspnea. And X-ray shows or ultrasound reveal this. What is this? Tracheoesophageal fistula. Then we can ask the same story, development of the respiratory system. Then the light microscopic appearance of trachea. You can build up, imagine this. This type of questions that you can develop some questions, case scenarios, and think. This is because we ask anatomy, only anatomy. Then esophageal septum. Then what are the other parts of the trachea? Then trachea is divided, this bronchial buds, 2 bronchi, and then primary, secondary, and tertiary bronchi, and then bronchioles, and then where this lung bud communicate with pharynx through the laryngeal orifice. Then larynx is derived from where? 4th and 6th pharyngeal arches. Larynx is a part of the respiratory system. Now you are writing the development of the respiratory system. If you write this sentence, then you will get another 3 or 4 marks. Then what is this? Pericardio-peritoneal canal. You can remember the development of the body cavities. What are the cavities? Pleural cavity, pericardial cavity, and peritoneal cavity. And the diaphragm is also there. Then pericardio-peritoneal canal. This lung developed into there, this expansion of lung buds or bronchial buds. Then same time, separation of this peritoneal and pericardial cavities. Then lung expand in the pleural cavities. Then alveoli. By 7 months, this gas exchange is possible. Then before birth, lungs are filled with fluid. Then you can explain this surfactant and this alveoli cells, epithelial cells. Then what are the abnormalities? Esophageal atresia, tracheoesophageal fistula. If you write these things, you will get full marks. Just these things, diagrams are in your recommended textbook, embryology book. You can see this esophagus, trachea, and the development of this lung bud, and then these are the bronchial buds, and then what is this? Pericardio-peritoneal canal. Then you can see the separate peritoneal cavity, pericardial cavity, and the pleural cavity here. Okay. This is another question. Just write down this, or if you have these past papers, try to answer to this question to follow the same guidelines method. State mean state. Draw label diagram. This is from the abdomen. When you finish your abdomen part revision, try to answer to this question. And if you want, you can bring your questions when you are coming. I don't know when you are coming. We don't know the situation of the country, the prevailing condition, COVID, and we don't know. But please prepare for your exam. You have enough time. Be relaxed. Always be positive. Think that you can pass anatomy. Not only pass, you can reach this distinction level, first class, uppers level. You are at home. You are safe now. You have good meal from your mother. So you are well protected now. Please study. Then write down to answer this question and bring the answer, or you can, if you are interested, you can just email your answer to me. I can help you. I am here to help you anytime. If you write your answers and send me, then I will correct it. Just send back to you. Okay. Other than those questions, these are the important things. Now, this is thorax. Can you hear me? Hello?
Yes, ma'am, we can hear you.
Yes, there are 9. Good. I am very happy. 9 out of 202, 9 students are with me. I am really happy. Please listen, take these important things and prepare. Okay. What are the other important things? You must know how to surface mark the pleura and the lungs and the fissures. Oblique fissure, horizontal or this transverse fissure, blood supply and lymph drainage to the lung. And also this is very important, structures related to the medial surface of the right and left lung. What are the differences? Right and left lung in hilum. And you should be able to identify the structures in the hilum. Maybe as a part of your essay question, you will get MCQs, you will get spots. It's a very common part. But now you can't see these dissections and these things, but internet, there are many anatomy things, structures you can see. And these books, atlas. And this is very important thing, mediastinum. What are the boundaries of mediastinum? What are the parts? Superior mediastinum, inferior one. Then you must know, we discussed these boundaries of superior mediastinum, then inferior mediastinum. What are the contents of the anterior and the boundaries of the anterior and middle mediastinum and posterior mediastinum? You must know the contents and relations. What is the main structure in the middle mediastinum?
The heart, madam?
Yes, very easy, heart. Then middle mediastinum extension, from where to where it extends. And also these things are very important for your viva as well, surface marking, how to surface mark pleura. And when skeleton is there, total skeleton, sometimes examiner can ask, please surface mark this pleura. Also the osteology of this thoracic vertebra, typical one, atypical one, how to articulate to adjacent thoracic vertebrae with the ribs, and to describe typical and atypical ribs, first rib, you must know. This is very easy. Hematism hit and anatomy is very easy. Then what is the other organ in the thorax? Other things you must know how to get these intercostal spaces. First, second, third, to surface mark the lungs, pleura, and the heart. And these axillary lines, mid-clavicular line, anterior, middle, and posterior axillary lines. And the boundaries of the thoracic cage. Heart. What are the things? This is very important structure. Not for viva, but gross anatomy spot. They say MCQs. You must know how to surface mark the heart. And the heart valves. Structure of the heart wall. What are the 3 layers of the heart wall?
Myocardium, endocardium, epicardium.
Myocardium, endocardium, and
Epicardium.
sorry?
Epicardium.
Epicardium. Okay, then you mentioned 3 layers, but it is not in the order. What is the innermost layer?
Endocardium.
Endocardium. Start with this endocardium, then myocardium is in the middle. This is the middle layer, and then epicardium. Epicardium, or what is the other name given to that?
Pericardium.
Sorry?
Pericardium. I'm not sure.
You are not sure that. Because just read this. Then anybody else? මේ දරුවා විතරයි කතා කරන්නේ. It doesn't matter. At least you are here with me. Nama denek 9 girls or boys, I don't know. You are really good. What is epicardium or visceral pericardium? Heart is located in the pericardial cavity. Pericardium. Then you must know the structural arrangement of the pericardium. Outermost layer of the heart wall is epicardium or visceral pericardium. Then what is next? Next to the exterior, outside the visceral pericardium, is the pericardial cavity filled with pericardial fluid. Then parietal layer of the serous pericardium. Visceral layer of the serous pericardium or epicardium, then pericardial cavity filled with pericardial fluid, thin layer of fluid, and then parietal pericardium. Then exterior to the outermost is the fibrous pericardium. Fibrous pericardium. Very easy. Make a harmal lazy darwo. Fibrous pericardium. Then what are attachment of fibrous pericardium? Dissection කරනකොට දැක්කේ මොනවද කියලා හිතන්න.
The diaphragm
Can you show? Yes, it is distally attached to the
diaphragm.
Diaphragm. If you are more specific, it is attached to the
Superior.
no diaphragm. What are the parts of the diaphragm?
Central tendon of the
Central tendon. Yes, central tendon. And then muscular ring, peripheral muscular ring. Development of diaphragm is also very important concerning this embryological development, thorax and abdomen. Embryological development of abdomen, this diaphragm. What are the 4 main parts of developing diaphragm?
Septum transversum.
Yeah, yes, good. Septum transversum will become in later central tendon. Then what are the deficiencies? Defect. This is very important again because we can ask another essay question related to this diaphragm. Diaphragmatic hernia. And again, same story. Then when you are doing this revision, thorax and abdomen, past papers ටික අරගෙන බලන්න. අහලා තියෙන questions මොනවද කියලා in recent past. You can exclude these things for essay, but you will get these things for MCQs, spots, or we can mix one part from some question and another part from another question and make different case scenario. So just take all these organs one by one: lung, heart wall. Then very easy we can make this describe the light microscopic appearance of myocardium. Very easy question. And the develop structural arrangement of pericardium. Then here we have to write all these things. This pericardium, it has two layers: fibrous pericardium and serous pericardium. Then serous pericardium is, again, it has two layers: visceral layer and the parietal layer. Visceral layer just covers the outer layer of the myocardium, forming this epicardium or visceral pericardium. And then fibrous pericardium attachment. Then this proximally it is attached to where? Fibrous pericardium.
To the great vessels.
Great vessels, yes, good. Then what else? If you can remember these reflections of the heart. What is, I can't remember that word. This transverse fissures, sinuses, oblique sinus and transverse one, they are formed by which pericardium? Visceral pericardium, not the fibrous pericardium. Then one, you mentioned these four parts of developing diaphragm. What is central tendon? What are the other three parts?
Dorsum center esophagus.
Yes, good. Read this part. This, I think this diaphragm is important. Development, structure, and the pericardium structure. What else? Blood supply to the heart. Blood supply, coronary arteries. You must know. There are two coronary arteries, anatomy and distribution, origin and distribution of right and left coronary arteries. And also venous drainage, don't forget that. Venous drainage, coronary sinus, cardiac vein. Drain into where? Venous blood. Again, you will get lot of, what is not lot, one or two gross anatomy spots. Okay, this is the important part, blood supply to the heart. Then this is histology. What are the histological components that we can ask during the, if we may prepare questions from the thorax? Structures of the thorax, histology. Elastic artery is one. Example, can you tell me examples for an elastic artery? And light microscopic, yes? Hello? Elastic artery. Pulmonary artery by aorta. First thing is the aorta. Pulmonary trunk. Pulmonary artery. Then you must know this histological appearance of elastic artery. Very easy. This three-layered structure: tunica, intima, media, adventitia, and this arrangement of elastin fibers. I think you have finished this revision of histology. Now look at this, your book, histology book. And look at all these histology, light microscopic appearance of heart muscle, myocardium. Then what are the other things when you are, if you describe this histological or light microscopic appearance of myocardium, other than this cardiac muscle fibers? What are the other things? Connective tissues, loose connective tissues, adipose tissues, you can see. What else? Adipose tissues can be there. And also, what is conducting system? Purkinje?
Purkinje fibers.
Fibers. Conducting system. You can see these fibers. Histological appearance. Look at this textbook, you can see. Then histology of muscular artery. What are the two important features that should be there if you want to identify this muscular artery? Internal elastic lamina and internal elastic lamina. Can you remember? And the external elastic lamina. Again, tunica intima, tunica media, and tunica adventitia. The diagram is then all these aorta and great vessels. Aorta. Again, this is important. Anatomy. Describe the anatomy. Gross anatomy of aorta. Can you describe it? Take this as a part of your essay question. Describe the anatomy of aorta. Origin. The root of the aorta. Ascending aorta. Arch of the aorta. Then descending aorta. Then you can surface mark at the same time. Take a clear. Write this question. Answer to this question. Describe the gross anatomy of aorta. Then describe the light microscopic appearance of aorta. Okay.
Yes, ma'am.
Then what are the branches? Now I'm not going to ask these things now. This is homework because you have time to study. Don't worry. Ada make it uttara clear. Aorta. Outer surface mark is aorta and the gross anatomy of aorta. Then descending aorta. It has thoracic part and the abdominal part. Then it descends. Where? It descends in the posterior mediastinum, in the thorax. Then it pierces the diaphragm. It passes behind the, or it descends behind the, which part of the diaphragm? What is the level?
T12.
T12. Harida? Because I can't remember. Then what is the structure? Which arcuate ligament? T12, which arcuate ligament?
Median arcuate ligament.
Median arcuate ligament. Crus of the diaphragm, right and left. Then it forms this median arcuate ligament and aorta descend posterior to the median arcuate ligament. Then it continues at the abdominal aorta. At the same time, you can describe these branches to the esophagus, esophageal branches. Then, what are the branches to the diaphragm? And then, what are the paired branches, unpaired branches, celiac trunk, superior mesenteric, inferior mesenteric. Then, what are the other branches? Renal arteries, gonadal arteries. What is the, it divides into, or it terminates, what is the vertebral level?
L4.
L4 divides into right and left.
Common iliac artery.
Common iliac artery, right and left common iliac arteries. Then what is the artery in the middle? There is another one, small artery.
Renal.
Renal, this is a paired one. This is just about. Just in the, yes, good. Then make karani kohomada? Take an atlas or your any book and then read all these, just look at all these branches of the descending aorta and what is the vertebral level. Then if, for example, then you can study celiac trunk and the branches of the celiac trunk and what are the areas supplied by this celiac trunk. Then superior mesenteric artery. Now I am talking this abdomen, but don't take it as you can't divide this is thorax and this is abdomen and no, this thorax and abdomen, you learn it together and do your revision together. Just finish. I think you finished this abdomen. Oh, no, you will next week. Okay. Then what is the other one? When you are, if you describe aorta, inferior vena cava. Yes, inferior formation of inferior vena cava, venous drainage. Which type of vein is that? Then inferior vena cava, light microscopic appearance. Then what are the veins or tributaries drain into inferior vena cava? And its location, renal vein, inferior mesenteric vein, superior mesenteric vein. Then what else? Portal vein, formation of portal vein. This different thing. I'm talking now abdomen, so just move to this side. Okay. What is this? Epicardium or visceral pericardium? This is the one I discussed with you. Epicardium, the third layer or outermost layer of the heart wall, or visceral pericardium. It's a dense sheath of fibrocollagenous tissue containing elastic fibers, collagen fibers, mainly elastic. Then outer surface is a, what is this? What is the epithelium here? Cuboidal or squamous? Do you know the difference between simple epithelia and stratified epithelia? Simple epithelia for secretion and absorption. Simple. Stratified epithelia for the protection. There are many layers. Protection. But pseudostratified is different. It is pseudostratified. It is for protection and also for secretion. Goblet cells are there to secrete and it has single cell layer. Oh. Then this coronary arteries. This anatomy of coronary artery. මට මතක නැහැ ළඟදී ආවද කියලා. Check it. Your past SCQ questions. That there are anatomy of coronary arteries. Or blood supply to the heart. Then coronary arteries. Describe the light microscopic appearance of coronary arteries. Then you can see adipose tissues in the visceral pericardium. This is important. Again, I am telling you. This is histology, but still important. I am not going to describe because you have done this. This is very easy. These are the examples: aorta, brachiocephalic trunk, common carotid, subclavian, and pulmonary arteries. Three-layered structure: tunica, intima, media, and adventitia. Then what is the thickest layer or broadest layer? Is the tunica media. Vasa vasorum there. When you are describing, if you get this type of question, describe the light microscopic appearance of an elastic artery. Then vasa vasorum should be there. Tunica adventitia, this collagen fibers. trachea. I'm explaining answer to your previous question. Describe the light microscopic appearance of trachea. I discussed this, so I'm not going to discuss this again. But what is this? This is epithelium. You must know goblet cells, basement membrane, then lamina propria. It's highly vascular. It contains loose connective tissues. Then submucosa with mixed seromucinous glands. Mucous cells are poorly stained. I showed you these diagrams. These are the different types of cells in the epithelium of the trachea. Ciliated columnar cells, goblet cells, serous cells, basal cells, and basal stem cells. The ciliated columnar cells are more common, numerous in lower trachea, but goblet cells and basal cells are more common in upper trachea. Why? Goblet cells, when this inspired air reach the trachea, most of these dust particles have been removed by the upper part of the respiratory tract, but remaining dust particles have to be trapped by these goblet cells in the upper part of the trachea. When it comes to the lower part, there are more ciliated cells and less goblet cells. But upper part, it has more goblet cells to trap these dust particles. Remaining dust particles, if they are, when it reaches to the trachea. Okay. If you have questions, you have 10 minutes. Be relaxed. This is very friendly discussion. You can ask questions. Any questions if you want help to pass your exam. Not pass. To get distinction, classes. Who are these 7 girls? Dimel, Disanayaka, SDHM. SDHM. Girl or boy? Disanayaka SDHM?
Yes, sir.
Girl. Good girl. Dimel, again girl or boy? Hello? Dimel VTK? I will take it. Jaimali? Yes. Can you tell me your full name? Not full name. Surname with initials. Jaimali?
Akshila Jaima. PDT.
Sorry?
PDT.
I can't hear you.
PDP Jaimali.
VT Jaimali. Patal.
Yes, madam.
Yes, good. ප්‍රශ්න නැද්ද ඔයගලන්ට? Proceed. Yes. Good. If you have questions, please ask. Now or later, anytime, I'm here to help you. Then Vitana CJ. Hello?
Madam.
Vitana CJ.
Girl, madam.
Yes, I can hear you. Good. Vitana CJ. If you have questions, if you want to correct your answer, essay questions, I'm always happy to help you. Okay. ප්‍රශ්න තියෙනවා නම් අහන්න. Ask your colleagues or friends. to answer these questions, and if they are interested, I can help you. No questions. Okay, then let's stop.
Okay, then thank you, ma'am.
Okay, you're welcome.
Thank you.
Thank you, madam.
Thank you,
Okay.
madam.
You're welcome.